New tonight, people in Oregon will face dramatically reduced consequences for possessing user amounts of certain illegal drugs, including ecstasy, heroin, and cocaine.
Basically getting a ticket instead of going to jail. As NewsNation reporter Lindsay Nadrich explains, offenders can either pay the fine or get it waived with a health screening.
We have one of the highest rates of addiction in the country, and we don't have the infrastructure to provide people the care that they need and deserve.
That's something this new law aims to change. Marijuana tax money will be used to cover the cost of 15 new addiction recovery centers and additional services.
There's a wait list of, as I understand it, of up to 4 months for people to get a residential treatment bed. And that's unacceptable, and we can definitely do better here in Oregon, and this is an opportunity to absolutely change that.
Ron Williams, the outreach director of the new Health Justice Recovery Alliance, says this is a start to connecting people to services and reducing racial disparities in our criminal justice system.
You know, Black and brown people are overrepresented in the criminal justice system and underrepresented in the treatment and recovery environment.
Law enforcement can still seize the drugs, but instead of arresting someone with a small amount of drugs, they will now give them a $100 ticket and the number to a 24/7 hotline to call for a health assessment. If someone calls the hotline, they will then get a letter they can take to court to have the fee waived. Actually seeking drug treatment after that is voluntary. And I learned there's no limit to the number of times someone can get a fine and call the hotline to get it waived. That's why critics have said this law may not work the way voters intended it to. The Oregon Health Authority, though, is optimistic it will work.
What we're looking to offer is an array of low barrier services that meet the needs of this population. And if we can do that effectively and engage this population, we think that there's a good likelihood that they will engage in treatment services that will help them engage in recovery and sustain that recovery over time.
For NewsNation Now, I'm Lindsay Nadrich.
And to help us go a little deeper on this story tonight, we're joined by two people with different opinions on this change in Oregon. Janie Gullickson works for the Mental Health and Addiction Association of Oregon and was part of the team behind this petition. On the other side, Chris Wigg is the director of a treatment program in the state. Thank you so much, both of you, for being with us tonight. We certainly appreciate it, and I'm sure there are lots of strong opinions on both sides here. So let me kind of start with what I think the chief critic would say. Janie, let's start with you a little bit. In terms of, I know that there's criticism out there that the country's war on drugs has been inhumane, but legalizing some of this hard stuff in a way, in terms of making it more like a traffic ticket, LSD, cocaine, heroin, oxycodone, ecstasy, in a country that already has a staggering addiction and drug problem, is this increasing the acceptability of very dangerous drugs by doing this?
Hi, thanks for having us on here to talk about this important new act in Oregon. So my response to that is, it's not legalizing these drugs. And I think there's some confusion out there about decriminalization versus legalization. These are very small amounts that people will be ticketed for. It is not for other crimes. It is not for other things that come with maybe a long-term addiction that are criminal or drug dealing. But this gives an opportunity before someone is incarcerated or criminalized for their health condition.
And Chris, to you for a second here, what I assume what critics of your side would say is that the war on drugs in America has been inhumane. You look at racial disparities and, quite frankly, a nation still ravaged by a drug problem. So this is putting more of an emphasis on treatment and getting people help that they obviously would need if they're addicted to some of these very hard drugs. So what is your complaint about this change of criminal procedure there in Oregon?
Well, during the campaign, the concern from the community of providers was, does this ballot measure, does it provide the treatment that is missing in the system? Will folks participate in the treatment without the mandate of the court? And does it take the criminal justice system and interventions like treatment court that have been proven effective to help people quit drugs, does it take those things off the table? But now that the voters have spoken, the critical thing is that the community of providers and the advocates for the measure and all of our criminal justice partners get together and deliver the treatment that was promised by the ballot measure.
And Janie, explain a little bit for folks who don't know, briefly, how the law would actually work in terms of it emphasizing treatment over incarceration or stiffer criminal penalties.
If someone is caught with small amounts of drugs, they are given this ticket. There is a phone number to call or an address to go to once the addiction recovery centers are established and, post-COVID. But the person would call the number, be connected to someone who has been there, done that, a peer recovery mentor who gives them a comprehensive health screening and asks, what it is that they are looking to get connected to. And if that's treatment and ongoing recovery support services, harm reduction, housing, those things will be offered to them through ongoing peer services and access to treatment.
And Chris, if you're not in favor of this plan, what do you think would be a better solution?
Well, I think that a better solution would have been to stick with the tried and true method, alternative to incarceration of treatment courts. However, that ship has left the barn, the voters have spoken, and so it's important that we all come together and deliver that treatment that was promised, that we need to provide housing, we need to provide access to residential treatment, intensive outpatient, and all along the continuum of care so that Oregonians who are suffering from addiction can get the help that they need.
And let me ask you both the same question. Oregon has a very long history of more liberal policies when it comes toward drugs, dating all the way back to the early 70s. Has it worked in that state? Both of you, I'd love to hear an answer.
I would say obviously it hasn't. Oregon has, the highest rates of addiction and the lowest rates to access to treatment and recovery support services. So it was time for a change. Chris?
I agree with Jamie that what we were doing has not worked. And a lot of that has to do with funding for residential treatment, that's the place in the continuum of care where there is the biggest disparity between the need and then the ability to provide the service. Residential treatment, our agency does not provide that, but it is very expensive. And so my hope is that the advisory council that's going to be handing out some of the marijuana dollars for this measure will prioritize residential treatment for Oregonians to get the help that they need.
There was a hint of agreement in your final answer, so that's a perfect spot to end. Appreciate both of you being with us tonight for your candor and for your commitment to this issue. Thank you both so much.
Thanks for having me.